In Nigeria,
No.
the indication is that we have entered a second wave of infections, and we stand the risk of not just losing the gains from the hard work of the last 9 months, but also not losing the precious lives of our dear citizens. The PTF believes that if we do the right things and adhere to the non-pharmaceuticals interventions and step up our testing and detection, loss of lives will be minimized and the rising curve will be flattened.
The small one is from what?
Let me remind you
Monitoring what?
about our cumulative numbers in the last weeks of week 49 to week 51 as follows. Week 49, 1,843. I repeat, week 49, 1,843. Week 50, 3,918.
Okay, so if you're recording now.
Week 50, 3,918. Week 51, Monday to Wednesday, half of the week, just half of the week, 1,889. It is also considered important to avail Nigerians the global situation in the last 3 days. Global cases crossed the 74 million mark, now at about 74,516,681 cases. United States of America crossed the 17 million mark, 17 million. The WHO Africa region has crossed the 1.6 million cases mark. The global case fatality ratio declined by 2.2%, while the WHO Africa regions remains at 2.2%. United States of America continues to record high daily case incidence of over 248,686 on a daily basis. And on the WHO Africa region, Nigeria ranks number 5 for both highest cumulative cases and highest cumulative death. Nigeria ranks number 5. The foregoing analysis, which will be elaborated by Honorable Minister of Health and the National Coordinator respectively, is to remind all Nigerians that 1. We are in a potentially difficult phase of the COVID-19 resurgence. Number 2, assessing the hope offered by the arrival of the vaccine is still some time ahead. Number 3, that vaccines alone cannot cure the virus. Rather, a combination of initiatives, including the traditional non-pharmaceutical interventions. That more than ever before, we need compliance. That we shall escalate our risk communication and community engagement strategies to higher levels this time around. Lives have been lost, still being lost, but we must slow down the pace of the spread, and now. And also to say that at the rate at which the numbers are rising, should be examined, and that our vigilance and compliance with the non-pharmaceutical interventions should be intensified. Ladies and gentlemen, last Tuesday, the PTF held an end-of-term technical session. It afforded the PTF the opportunity to assess the progress made and the present dangers that confronts us. The report of the PTF will be submitted to Mr. President on Tuesday, 22nd of December, the year 2020. Current realities, however, point to the fact that the course of further opening up of the economy may have to be reviewed. The festive session, this festive period, is here, and we remain conscious of the fact that large gatherings, events will take place. It is our strong advice that all non-essential trips be cancelled outright. This thing is real. It's happening daily. Infections are rising, and the spread is going farther and farther, and we cannot be complacent. We urge dear Nigerians to please avoid large gatherings. Before I invite Honorable Minister of Health, I wish to state that for the first time since March, our dear chairman of the PTF is absent from this briefing. As you are already aware, he is self-isolating out of abundance of caution and in line with our protocols. We wish him safety and wish the members of his family very quick recovery, and all of those out there who are infected by this deadly disease. And I wish to invite my colleague, the Honorable Minister of Health, followed by the DG, NCDC, and the National Coordinator to update you from the technical perspective. I thank you very much for listening.
Good evening, everybody. The acting chair of the PTF, honorable ministers, the national coordinator, director general, ladies and gentlemen. I used to receive, or rather I used to hear, congratulations, we are flattening the curve. And my answer was always, don't rejoice too early. We are not yet out of the woods. And that is what we are facing now. That the number of confirmed COVID-19 cases continues to rise, with the total number now 75,062 as of this morning. A record number of 930 new confirmed cases were diagnosed yesterday, the 16th of September 2020. It is the highest daily number recorded since the virus was detected in February 2020. And this is what we have been warning about for many weeks. And it gives cause for us to worry, not only about the causes, but also about the course of events as they unfold over the next few weeks. As the time of festive season and holidays approach, the risks are going to increase. Many people will want to celebrate. Many will want to crowd into shops, markets, places of worship. Many will want to travel with mass transit transport. Or even many will be flying into the country from abroad, including from high-burden countries. All these are circumstances that are proven worldwide to accelerate COVID-19 transmission. And they have caused explosive increases in COVID cases in other countries. I want to use this opportunity to urge all Nigerians to do all they can to stay in their homes, except you have a very urgent case or you have a very good reason to want to travel, because you increase your risk, especially inside crowded transport, crowded buses and taxis, and also the risk of meeting people and finding yourself in a crowd when you do not want to be in a crowd, and finding yourself in gatherings and and where people gather where you cannot easily get away. Our epidemiological trend has already started to show that the COVID curve is rising, with the total number of active cases now 7,087. And there's a corresponding increase in the number and seriousness of cases requiring hospital admission in high dependency units for oxygen treatment or in ICU intensive care units for mechanical ventilation. If we include those who are in hospital with severe symptoms for being observed, the need for more hospital beds will become acute. And this is an indication of what the second wave is. For those of you who look at television frequently, you will have seen the pictures from Europe, from Spain, from France, from the UK. And we still want to be able to avoid that. And to do that, all of us have a role to play, both those in government and those who are not in government, those who are doctors, nurses, and those who are not. This is a common problem, it's a national problem, and we all have responsibilities. Following this new surge, the Ministry of Health is working with federal tertiary hospitals on the reactivation of all treatment centers. We are assessing resources available and resources needed, and we are alerting frontline health workers to be on standby. We are strengthening the COVID-19 home care treatment protocol for asymptomatic and mild cases and community-based care, which is usually organized by Primary Healthcare Development Agency, to manage asymptomatic, mild, or moderate cases in a way that they will not infect others. We have also commenced the inventory taking, and we plan to distribute a wide range of resources available in our warehouses according to need. These include personal protective equipment, various commodities, equipment, and consumables for deployment to treatment centers. To strengthen manpower needs, we shall step up continuous nationwide training of various cadres of health workers, especially ICU nurses and intensivists, biomedical engineers, and so on, to ensure proper utilization and maintenance of ventilators and other equipment, especially the critical ones, while we also improve knowledge and skills of personnel as we learn more and more about COVID-19. On the back end, our technical working group is around the Primary Healthcare Development Agency of the Ministry of Health. It's examining modalities to obtain access to vaccines for Nigeria. We are in conversation with WHO Gavi on the COVID COVAX AMC facility to support about 170 lower and lower middle income countries to which Nigeria belongs to access anti-COVID vaccines. At a presentation to the Ministers of Health of the ECOWAS region today, under the West Africa Health Organization, the African Regional Director announced that COVAX had been assured vaccines for just about 20% of the quantity of vaccines that is required for lower, middle, and low income countries. Many high income countries, wealthy countries, high resource countries have secured first rights to vaccines and already paid down for their citizens. And in some cases, we hear some have paid for double their number of citizens. We continue to closely follow issues related to vaccine development. We are holding talks with representatives of vaccine developers to work out additional or, if need be, alternate sources to meet national security needs. Nigeria will be working on a mix of public, private, and external funding to meet the payment. We understand that the World Bank has made a facility available on which countries can draw. The African Union has also set up an African vaccine acquisition team aiming to acquire vaccines for up to 60% of the population. The fourth meeting of the ECOWAS Ministerial Coordinating Committee on COVID-19 held today, of which His Excellency the President of the Federal Republic of Nigeria is the ECOWAS champion. The committee applauded the decision of the Federal Executive Council to approve the decision of His Excellency the President to approve the reopening of our borders at 4 positions, and also recommended easing of cross-border travel and trade in the ECOWAS sub-region. Harmonized guidelines have been developed and agreed upon as an important tool to control cross-border movement